On 18th March this year, Uganda closed her borders, barring both in and outflow of traffic except cargo as a way of limiting the spread of COVID-19. This decision left many locked out of the country, including the Watoto church choir members. Now, with 2 months down the road, the Watoto leadership says all is well with the team abroad.
We can't wait for the time that will come when we have to receive them back home, but they are all doing well, thanks be to God.
This was revealed by the Watoto leadership Friday afternoon as the church donated an assortment of medical supplies worth $20,000, an equivalent of 74,850,000 shillings. The team that was led by Pastor Julius Ruotlonyo justified their gesture as a give-back move following total recovery of some of its members from the pandemic.
The government procedure of quarantine was very helpful. Had that process not been there, Edwin would have never found out that he had it. The team came and they were all healthy. But besides them benefiting from it, the community was saved from it. And the church, was saved from it. So we are so thankful. Every year we give an offering that we call the missions offering. And out of that missions offering as Watoto Church, we wanted to contribute, and we are contributing to you a humble gift from us to help the health workers, especially with the protective wear.
Edwin Najuka, one of the recoveries, is a Watoto church goer who witnessed the donation.
We're also super grateful to the entire medical team, the frontline medical team that was looking after us, making sure that we were supported, making sure that we're taken care of, and it's because of their support that we're able to recover quickly, and we are super, super grateful for that.
At the receiving end was the Minister for Health, Dr. Jane Ruth Acheng, accompanied by Dr. Diana Atwine, the line permanent secretary. In her remarks, Minister Acheng lauded Watoto Church for the donation, saying it will go a long way in boosting the supplies to the core team.
Government is grateful that you have chosen to partner with us in this response to the COVID pandemic. And government is grateful that you have chosen to remember especially the core teams, that is the health workers, who are night and day working very hard to ensure that people who fall sick get out of the hospitals, and that people who fall sick can live to testify to the rest of the people what it means to have COVID.
We believe that this, what you have given us, it is going to add another weight to and support to our health workers. This is a need, a big need. The PPEs, we cannot tell you the gap. It's so huge. So every time we get someone to support us to bridge that gap, we are so grateful.
Commenting on the issue of truck drivers, Minister Acheng assured the public that the ministry has put her best foot forward with adequate number of staff at every border point.
We have adequate number of staffs at the border points of entry. Through collaboration with the Ministry of Public Service, the PS has ensured that we have staff who are based there. They are being accommodated there, they are being fed there. At Malaba alone, we have over 70 health workers carrying out the screening on a daily basis. Busia and Mutukula Busia has nearly 40, Mutukula has about 30. So depending on how heavy the border point is, the numbers are there. So we don't have a shortage. What delays return of results has been unpacked, because bringing samples from the border points of entry to the central region where we are testing takes a bit of time. But when the tests are done, results need to be returned in the shortest time possible. We have now managed to put computers so we can scan the results and send them back online. And hopefully, by the end of this week, which is today, Sunday, everything will be sorted out.
Meanwhile, the Ministry of Health has confirmed reports of cholera outbreak in the northeastern district of Watoto, though, according to Dr. Jane Ruth Acheng, the situation is under control. Dorcas Kimono, UBC TV News.